Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our bi-weekly update regarding the coronavirus pandemic in the state of Maryland and also here at GBMC. It appears that Maryland hospitalizations have hit a plateau. Over the past 2 weeks or so, we have not seen much increase in the number of Marylanders who are in the hospital. We have not seen a decrease, but at least we have hit a plateau. At GBMC today, we have 30 COVID-19 positive patients in the hospital, and 3 of them are in the intensive care unit. We still have plenty of capacity to take care of sick patients. I want to remind everyone that as we are talking more and more about vaccines, it is still very important that we each wash our hands, maintain social distancing, and wear masks. It's going to take us a while to get enough people vaccinated that we can end the pandemic and therefore go back to not wearing masks. For right now, please keep it up. So what about the vaccine? Yesterday at the governor's press conference, he spoke about his desire to see people getting vaccinated more quickly. Maryland hospitals have all gotten multiple shipments of the vaccine, and we are working hard to immunize healthcare workers first. Why are we doing that? We're doing that because we owe it to people who have been standing up against the virus to protect them first, but there's also a second excellent reason. We do not want the healthcare providers spreading disease to patients, and we want them all able to care for your loved one if she gets sick. The governor and his people talked a lot about people trying to jump the line, people who are not frontline healthcare workers trying to get the vaccine, and he asked people to stop doing that. Their turn will come. My hope is that by the end of the spring, we can have immunized most Marylanders. And if you think about it, that's just a few months away. At GBMC this week, we are moving beyond intensive care and ED workers and doctors and nurses directly taking care of patients, and we are now immunizing the rest of us, including me. I will get my vaccine today because the rest of us that are in these buildings are at risk, and we also should not be the vector of disease to others in the community. Let me talk a little bit now about what happened at GBMC on December 6th. We were attacked, and all of our tightly connected computer systems went down. In addition, we have telephones that work via computers. They went down as well. So if you are our patient, please let me extend my sincere apology to you, as you were not able to access your own medical record. You were not able to communicate with us through our patient portal, which is called MyChart. And probably most importantly, when you called us on the phone, you got either a dead signal or you were on hold for very long periods of time. We have now brought all of those systems up. You can look at your own medical record via the patient portal or MyChart. You can make appointments through MyChart for primary care, and you can call us on the phone. A bit of a word of caution about calling on the phone, because there is this pent-up demand after almost a month of not being able to get through on the phone. Our phones are extremely busy. We are working as hard as we can to answer the phone as fast as possible, but I ask you to continue to be patient with us and give us a couple of weeks to get back to our normal steady state. Please use the patient portal MyChart when you can. So let me end as I always do by saying thank you to every healthcare provider, especially those at GBMC, who have been standing up to the double threat of the pandemic and working without the computer system. Let me also thank all healthcare providers throughout the state for standing up to the pandemic. And let me thank all of you in the community for your patience with us, for your excellent hand hygiene, social distancing, and the wearing of masks. Be safe. We are here to serve you if you need us, and we hope to see you soon. Thank you very much.